Welcome to CME on ReachMD. This episode is part of our Minute CE curriculum. Prior to beginning the activity, please be sure to review the faculty and commercial support disclosure statements, as well as the learning objectives.
Hi, this is CME on ReachMD, and I'm Dr. Karin Blakemore. I'm here this morning with Dr. Emilie Vander. Dr. Vander, could you discuss the importance of screening for NAIT?
We discussed previously that there's really no universal screening protocol in use for FNAIT. There's significant debate regarding best strategies, cost effectiveness, but it is something that in theory might be useful, although would not necessarily give us as much information as we would like on the actual risk of affected or severe FNAIT in these pregnancies. Most proposed universal screening strategies really only focus on the single HPA antigen, typically anti-HPA-1a as the antibody and the HPA-1b as the antigen, because 80% of severe FNAIT in Caucasians is related to this HPA-1 entity. Sort of screening for that we perform in pregnancies already known to have a prior affected pregnancy by FNAIT. The standard detection method for anti-HPA antibodies is monoclonal antibody immobilization of platelet antigens. This uses specific reagents to investigate antibodies against epitopes on different glycoproteins. While this process remains the gold standard for platelet antibody detection, it is a complex procedure that requires significant specialized expertise and really is typically only performed at very specialized reference laboratories, making it sometimes difficult to obtain. And in the US, there's really only one reliable reference lab right now. So testing can sometimes be either a little bit delayed because it's a send-out test or costly for patients. As Dr. Blakemore previously described, women with a known history of FNAIT should undergo platelet antigen genotyping of the mother and the father in order to understand potential risk for future pregnancies. Because in couples where a father is heterozygous, there can be a possibility of either an affected or unaffected pregnancies with future generations. In women who are currently pregnant, there is next generation sequencing on cell-free DNA theoretically available for placental trophoblasts and maternal serum in order to help determine fetal HPA genotype. However, testing is not really widely available yet. And since it's only looking at one specific platelet antigen, it wouldn't be necessarily comprehensively available. So amniocentesis still plays a role in helping determine fetal genotyping in these these questionably affected pregnancies.
Yes, it'd be nice if universal screening that identified an incompatible couple, so to speak, would then be so easy as to predict that the fetus had a risk for FNAIT, but most of the time, those couples do not have a risk for FNAIT, and we don't understand everything about it. The antibody test is helpful to corroborate, but when they're there, it still doesn't mean the baby's at risk for FNAIT. When they're not there, the baby might still be at risk for FNAIT, but the antibody test, it's complex, but the testing methodology has improved over the years, and it's become more reliable as a way of figuring out not just the incompatibilities, but which incompatibility, because there could be more than one between a couple for these many platelet alloantigens. And which one, if we were to perform an amniocentesis or maybe down the line in the future using cell-free DNA in the mom's blood, looking at the fetal antigen, we could then determine whether the fetus is indeed at risk. And again, this is only for fathers who are heterozygous for the antigen that seemed to have caused the proband's problems. Well, this has been a grand discussion, and I want to thank you. And with that, we'll move on to further discussion about the treatments.
You have been listening to CME on ReachMD. This activity is provided by Omnia Education and is part of our Minute CE curriculum. To receive your free CME credit or to download this activity, go to reachmd.com/CME. Thank you for listening.